Welcome to our YouTube channel Medical Subjects Made Easy. Today we'll be dealing with MCQs regarding tetanus. So the first question is, what is the causative agent of tetanus? Streptococcus pneumoniae, Clostridium tetani, E. coli and Mycobacterium tuberculosis. Second question is, how does Clostridium tetani primarily enter the human body? Ingestion of contaminated food, inhalation of airborne droplets, contamination of wounds with spores, direct person-to-person contact. Third question, what is the primary mechanism of tetanus toxins action? Destruction of red blood cells, interference with inhibitory neurotransmitter release, blockage of antibody production, damage to the liver. Fourth question, which of the following is a characteristic symptom of tetanus? Diarrhea and vomiting, muscle rigidity and spasms, lockjaw, skin rash and itching, joint pain and swelling. The fifth question, what is the global burden of tetanus estimated to be? First one, thousands of deaths annually, millions of deaths annually, hundreds of deaths annually, and fourth one is negligible deaths. The sixth question, in which regions are majority of tetanus cases reported? North America and Europe, Australia and New Zealand, Africa and Southeast Asia, and South America. Seventh question, what is the primary goal of neonatal tetanus elimination? Complete eradication of Clostridium tetani, incidence of less than one case of neonatal per 1000, reduction of NT mortality, elimination of all tetanus cases. Eighth question, which of the following is a significant risk factor for tetanus? Urban living, vaccination, unclean wound management, high socioeconomic status. Ninth question, what is typically incubation period for neonatal tetanus? 1 to 2 days, or is it 7 to 10 days, or is it 3 to 4 weeks, or is it several months? The 10th question, what is opisthotonus? Stiffness of the jaw, or contraction of facial muscles, or severe muscle spasm causing arching of the back, or difficulty in swallowing. What is rhizus sardonicus? Muscle rigidity of the abdomen, sustained spasm of facial muscles, poor sucking and feeding in neonates, muscle rigidity of limbs. What is the most common early symptom of tetanus? Fever, or is it the stiffness of jaw, that is lockjaw, or is it headache, or is it abdominal pain? 13th question, what is the operational case definition of neonatal tetanus? A child with fever and rash, or child who lost the sucking ability, child with cough and cold, and child with the diarrhea. 14th question, what is the operational case definition of adult tetanus? One of the following signs, trismus sardonicus, or fever and cough, abdominal pain and vomiting, headache and dizziness. Which vaccine is used for primary immunization of tetanus? MMR, pentavalent vaccine, polio vaccine, or is it influenza vaccine? How often should adults receive a tetanus booster shot? Every year, or is it every year, or every 5 years, every 10 years, or every 15 years? What is recommended treatment for tetanus? Antibiotics and anti-tetanus serum, or is it antiviral medication, or is it antifungal medication, or is it just pain relievers only? What is the purpose of administering ATS? Is it to kill the bacteria, or to neutralize the tetanus toxin, or to prevent a wound infection, or to reduce fever. Which of the following is a key strategy for preventing neonatal tetanus? First one is routine antibiotic use in newborns, or administration of tetanus toxide to pregnant women, or isolation of newborns from their mothers as soon as they are born, use of contaminated delivery kits. And what is the function of spatula test? Is it to detect a fever, to detect abdominal rigidity, to detect a tetanus by observing spasms of jaw muscles, to detect a respiratory distress? Answer key and explanations. The first question. First question. The answer. The first question is, what causes tetanus? Clostridium tetani. Tetanus is specifically caused by the toxin Clostridium tetani. Second question. Contamination of wounds with spores, or tetani spores thrive in anaerobic conditions which are found in deep wounds. Third question is, what is the primary mechanism of tetanus toxins action? It is interference with inhibitory neurotransmitter release. The toxin, it blocks the release of inhibitory neurotransmitters, leading to uncontrolled muscle contractions. Fourth question. Which of the following is characteristic of symptom of tetanus? It is muscle rigidity and spasms. Lockjaw, this is the hallmark symptom of tetanus. And fifth question. What is the global incidence? What is the global incidence of tetanus? Is it millions of deaths? It is millions of deaths annually. Despite being preventable, tetanus remains a significant global burden. So it is millions of deaths. The sixth question. Sixth question is, in which regions are the majority of tetanus cases reported? It is Africa and Southeast Asia. These regions have often limited access. Okay, so it is Africa and Southeast Asia. Seventh question. What is the incidence of neonatal tetanus? It is 1 case per 1000 live births. So that's the seventh question. Eighth question. Which of the following is a significant risk factor for tetanus? The answer is unclean wound management. This provides entry point for Clostridium tetanus spores. Ninth question. Which is the typical incubation period of neonatal tetanus? It is 7 to 10 days. This is the typical incubation period for neonatal tetanus. And 10th question. What is opisthotonus? Opisthotonus is severe muscle spasm causing arching of the back. Opisthotonus is a severe form of muscle spasm associated with tetanus, arching of the back. Then the 11th question is, what is rhizus sardonicus? It is sustained spasm of the facial muscles that produce a grinning expression. So it's the facial muscles. This is a very specific sign of tetanus. And what is most commonly early symptom of this one? It is stiffness of the jaw. First sign is trismus. So trismus is the first sign. So what is the operational case definition of neonatal tetanus? It is child who lost the sucking ability between 3 to 28 days because of the neonatal period and becomes rigid. The facial muscles, they get stiffened, and because of that child loses the sucking ability. And 14th question is, what is the operational case definition of adult unital tetanus? So this is the WHO. One of the following signs should be there. That is trismus, sardonicus, painful contraction of muscles. This is the operational case for adults. So that was for the kids. Okay. So 15th question is, which vaccine is used for primary immunization against tetanus in infants? It is pentavalent vaccine. So in the pentavalent vaccine, a component is tetanus toxoid along with the other 4 vaccines. So that happens. That's the 15th question. The 16th question. So how often adults should receive a tetanus booster? It is every 10 years. So this is the recommended interval for tetanus booster shots in adults. Not 5 years, not 15 years. It is 10 years, every 10 years. So what is the next question is, what is the recommended treatment for tetanus? It is antibiotics and anti-tetanus serum. Antibiotics kill the bacteria and ATS neutralizes the toxin. So anti-tetanus serum neutralizes the toxin. And what is the purpose of anti-tetanus serum? It is, the answer is B, to neutralize the toxins, tetanus toxin, that is ATS provides passive immunity by introducing antibodies. So that is, the 19th question is, which of the following is the key strategy to prevent neonatal tetanus? The answer is B, administration of tetanus toxoid to pregnant women. This ensures that protective antibodies are passed to the fetus. And the 20th question is, what is the function of spatula test? The answer is to detect tetanus by observing spasms of jaw muscles upon touching the posterior wall of pharynx. This test checks the hyperreflexia of the jaw muscles. Thank you for your patience. Have a good day. Welcome to our